Hi everyone, Glenn and Christy with Assisted Living Locators. We wanted to take a moment this afternoon to share some information with you that we think is pretty important during this difficult time, and know that it's for everybody out there, not just our seniors. We've all seen that this virus is targeting all age groups and affecting those mostly with the underlying medical conditions.
True. And, we are not a doctor or a nurse. Your primary care physician is still your best resource for any health concerns you have. But we have connected with our friends in the healthcare industry over the last week, and things have obviously changed quite a bit again this week. Last week we were talking about a respite stay maybe as a good way to keep someone socially isolated, make sure that they had all of the things they needed. In the last week, communities have started to stop admissions, some from home, some from communities altogether. So we've actually had to keep a running list of communities that are opening and accepting admissions at this point. So things are changing quickly. The best advice at this point seems to be social distancing, trying to stay at least 6 feet away from other people. So avoiding large gatherings, going to unnecessary doctor's appointments, elective surgeries, getting your taxes done, that's been extended. So anything that can be put off for now, leaving the house, should be put off for now. Things like PT, OT, and speech, obviously talk with your physicians about that and get their opinion of whether it's worth the risk or not. But even going to the supermarket, so last week we had talked about some shortages of some goods in supermarkets and things. Those have really started to turn around a little bit. We're noticing more on the shelves ourselves, and a lot of supermarkets, even BJ's Wholesale Club, have extended 60 and older shopping hours first thing in the morning, so folks 60 and older can get access to things fresh off the truck, overnight delivery, and not have to worry about having so many people in the store with them, again enforcing that social distancing. One of the coolest things that we've seen in the last week is a restriction on requirements from Medicaid and other health insurance companies regarding therapy. So in the past, therapy had to occur one-to-one in person. Because of social distancing, those restrictions are getting loosened up, and now phone and online therapy is available as well. So for me, I've been blessed enough to have Christy to be able to go through this with. I'm feeling a lot of anxiety and concern as well. So for folks that are looking to connect with somebody just to talk with a little bit, those resources are now available in a way that allows for that social distancing.
So wonderful, because that's really important at this time to make sure your mental health is just right up there with your overall health.
Absolutely. It's just as important as everything else. We've talked about social isolation in the past, and this is certainly a driver of it. So for folks looking to connect with that or any other resources, we're always here. You can reach out to Christy and I anytime. The state of New Hampshire also has a wonderful service called Service Link, and you can access that referral system through two different methods. Any folk in the state of New Hampshire through 211, simply dial it and hit send, and that will connect you with a phone bank manned by the Granite State United Way that can do online referrals to most services around the state. If you'd rather do it on the internet, Google Service Link NH. You should see this logo pop up. That's the correct one. Again, same database, just an online version instead.
Thank you very much for listening. Stay healthy.
Stay well.